Hello everyone, this is Dr. Nasser and my student assistant Israel Gomez and I have decided to create a series of video clips that evaluate the slides that are assigned to clinical hematology course at California State University, Dominguez Hills. In this series, we will evaluate blood smears from various conditions. I will highlight the characteristic of each condition and discuss the morphological changes that you may be able to observe in a blood smear in respect to that condition. Regarding the blood smear evaluation, the most important first step is to identify the proper area to evaluate blood cells. Right now, we are in an area that some of the cells are stacked up on top of each other, as you may be able to see in these areas. This phenomenon is referred to as a ROLU, but you have to be very careful about ROLU because even in normal smears, you would be able to observe ROLU if you go deep into the crowded area of the slide. So we cannot consider this a ROLU and we should not report it until we are able to confirm that this is indeed truly ROLU. For that purpose, always remember that you are trying to get out of the slide as far as possible, and you will come to an area that now the cells are not stacked up on top of each other anymore. In this area, there is no ROLU. Therefore, the previous ROLU that you are observing is an artifact. This is very important to identify a true ROLU that is quite common in various conditions such as multiple myeloma, and false ROLU because you are looking in a crowded area of a slide and you basically observing an artifact on the smear. If we further go outside of the smear, you're going to come to an area that we refer to as the feather edge. Feather edge is the area that the cells are too far apart. You have these gaps of air in between there, and cells have the tendency of losing their morphological characteristics when you look at them in this part of the smear. RBCs are going to look like spherocytes and they are going to appear round. However, that is not true about the characteristic of those cells. So cells lose their morphological characteristics in this area. So this area is not also a good area to observe the morphology of the red blood cells. So I go to the area that basically a few cells may have overlapped, but many of the cells that are present here are distinct and separate from other cells. Now, I would like to go to higher magnification in here, and you can observe in a good area of the smear that you evaluate blood cell morphology, you have a couple of cells that may overlap, but there are many cells that are going to be distinct and separate. This is the best area on a blood smear to evaluate the highest and most important characteristics of a blood smear, and that is going to be cellular morphology, parasitic infections, various hematological findings should be determined in this area of the smear. So from now on, we will focus on the morphology of various cells in various conditions at this part of the slide. That is the end of the introduction video. Thank you.